So we're here because we've got a couple of questions, and I think they're quite interesting. You may benefit from it, so I'd like to respond this way. So let's listen in to what we've been asked first.
Hi Andreas, good morning to you. I was wondering if you can give me some advice, please. If you look at the picture of the lady that I've just
So I'll
seen you,
start
I've
over
done
again.
some work on. Hi Andreas, good morning to you. I was wondering if you can give me some advice, please. If you look at the picture of the lady that I've just seen you, I've done some work on her. She's about 66 years old. And you will see that the one eye, if you look at the picture on the right hand side, is far more droopy than the eye on the left hand side. So I was wondering, is there a different kind of something that I should do in terms of the way that I place the spots to sort of lift the one eye more than the other eye, because it's evident that the one eye, like I said, is far more droopy than the other eye. And with the previous upper eye, there was very little result, if any, and I've compared the pictures as well. So I was just wondering, maybe there's a different method, to get that right eye to lift more. And also the bags underneath her eye, there was maybe a 3% improvement, in the bags. It might also obviously be that it is just, a genetic thing, that their family is prone to have bags under the eyes. And then sometimes, the clients also wants miracles to happen. But I was just wondering if you could give me some advice on the upper eyelids, but specifically where the one eyelid is far more droopy than the other one, and then also the bags that I have worked on that has shown very little improvement. I'll appreciate any feedback, and any assistance there would be greatly appreciated. Thank you.
No, it's quite interesting. So the first question is the upper eyelids. I would say I would work only on the one that is very droopy first, and not as many sessions as required to get as a lift as possible. And then once that's done, then I'll actually start working on both. But again, as we tried to say before, on a case like this, the easiest option is always surgery. You actually get rid of the problem within one treatment, one swelling, one bruising, and so on, by doing a blepharoplasty. But so you've got to tell that to your clients. This is what we strongly advise, just to tell what the best option that you think are for them, even if it means that you're not going to get their business, because and in many cases they still will not want to go through surgery. So in the case that they do decide not to go through it, then you just I would advise you just go and treat just that eye, and as many times as required to make it as even as possible. And then when that happens, then you just work on both of them. As the lower eyelids, if the bags do not normally disappear, we had some reports of a dramatic improvement of the eye bags, but that's not something to expect anyway. What you would expect is a tightening of the lower eyelids, not the eye bags to disappear. However, we still had some reports of great improvements on the eye bags. That doesn't seem to be the case in this, according to what we will listen. But again, we would advise anyone to keep filming their procedure, so at least we can actually see what has happened and how the treatment was carried out, so we've got more data. Hopefully that clarifies the advice here.